So let's talk about insulin resistance and its role in heart disease because maybe people don't understand how does that cause this. Can you kind of explain how an insulin resistant person can get heart disease from an elevated insulin state?
Yeah, so it turns out that there are a couple of pathways by which insulin resistance leads to heart disease. And this is interesting stuff, right? So, the one I would say is most obvious is when insulin resistance progresses and people's blood sugars start to increase. That increased blood sugar causes damage to the blood vessels. And that's kind of the most obvious linkage between insulin resistance and heart disease. But there are a couple of other things that go on with insulin resistance that contribute to heart disease as well. It turns out that at a sort of cellular level, the mechanisms of insulin resistance, we're talking about the sort of receptors on the cell that are involved in this. There's some crossover with a chemical called nitric oxide. And people may have heard of nitric oxide. Nitric oxide is one of the chemicals that our body makes to help protect our blood vessels. So, nitric oxide causes the blood vessels to relax and kind of enlarge some. And nitric oxide also helps protect the endothelium, that lining of the blood vessel that we're trying to keep intact. And when you're insulin resistant, it causes your nitric oxide levels to decrease. And so, this is another reason why insulin resistance can cause heart disease.